We're really excited to announce decision to fund 5 different continuous glucose monitors, 2 different insulin pumps and their consumables from the 1st of October. It's the first time that we've funded CGMs, but we estimate that around 12,000 people will access CGMs in the first year of funding, and that number will rise to about 18,000 after 5 years. For insulin pumps, there's currently around about 4,800 people accessing funded pumps, and we expect that number to rise even further up to 10,000 people over 5 years. A continuous glucose monitor measures and tracks the amount of blood glucose in your body. An insulin pump supplies insulin to your body to keep your blood sugar levels healthy. The 2 devices can work together in what's called an automated insulin delivery system. When the 2 devices work together, one device, the continuous glucose monitor, measures and tracks how much blood glucose there is and lets the insulin pump know whether to deliver more insulin or to pause further doses. Our clinical advisors have told us that these devices will work for most people with type 1 diabetes. The competitive process that we ran allowed us to look at both devices, assess them and see how they work together. Throughout our assessment, we've heard that flexibility, choice and how the devices work together is really important for people. As a result of this decision, the Medtronic insulin pump will be delisted. That means that people who are using the Medtronic insulin pump will need to work out which of the funded options is right for them, and they will have up to 2 years to change to one of those funded options. We have been able to extend the transition period from 12 months to 24 months, and this is to give people a bit more time to work out which option is right for them and time for their healthcare professional to help them change over. We know that everyone is going to be really excited and want to book appointments with their nurses or their doctors or their clinical team as soon as they can. As soon as they've heard this news, they'll be wanting to jump on the phone and book an appointment. We know that the doctors and nurses and the clinical healthcare practitioners that care for you will also want to get you started on these devices as soon as they can. But we also know that the health system is stretched at the moment, and so people may need to be a little bit patient while they wait for their appointments. What you can do now is to start familiarising yourself with the products and getting your appointments booked. We know it's been a really long wait for people with type 1 diabetes, and we're really excited to give this announcement today. Thank you very much for your patience.